Namaste, welcome back to our channel Ayurveda 360. So on February 16th, 2022, there was a Gazette notification from Government of India through NCISM, National Commission for Indian System of Medicine. So the notification has given certain major changes in the education system of Ayurveda, especially the undergraduation. So in this video, we are going to see in nutshell the brief information related to the NCISM notification. So watch this video till the end to get proper information. So in the Gazette notification, we can see a major change in the academic system of BMS. At the same time, there are few things which are not changed, like the eligibility criteria to enter the BMS. Like right now we are having 50% minimum marks in +1 and +2 with subjects being physics, chemistry and biology. Majorly biology, PCM students are not eligible, PCB students are available. In each state there may be slight difference, but the subjects should be physics, chemistry and biology. And by the end of that academic year, by that calendar year, the student should have reached at least 17 years of age. So these are certain common things which are not changed. The student will be getting entry into any BMS college through a NEET exam, central NEET exam, and the central counseling will take place as usual. So there are no changes in relation to this. Even the degree, what is to be awarded to the Ayurveda's undergraduate student will be the same as now. So what are the major changes? We are going to see in this video in brief. So the seat distribution in relation to government college and private college, as you can see the all India quota. So in relation to the deemed universities, so deemed universities and it could be even government or it could be even the private. All the quota should be open to all India quota. All the seats should be open to all India quota, 100%. There is no state reservation for any of the deemed university of state or the government. You can say the government or the private, 100% are coming under all India quota. Whereas in relation to the state government and state government aided colleges, institutions and the private institutions, 85% of the seats are to be filled by the particular state students and 15% will be open up for the all India quota. So what it means is, if there is a college in Maharashtra and it is run by the government of Maharashtra, then 85% of the seats are reserved for Maharashtra students, 15% is reserved for out of Maharashtra, other than Maharashtra, whichever state is applicable. So this is in relation to number of seats applicable, in relation to the quota, and in relation to the PWD, that is the PWD quota, 5% of government and government aided institutions seats are reserved for PWD quota. So how it is made based on the individual college will be through the roster, and each year the roster may change with 1 or 2 addition or deletion of the seats, but ultimately total seats should not be less than 5%. So this is in relation to the seat distribution for any of the BMS colleges. Now the duration is same, 4.5 years of study and 1 year of internship. Right now what is happening? There are 4 academic years, professional years, like first BMS, second, third, and the last BMS being 1.5 years, 1 and 1.5 years. So in that way we are having 4.5 years course now. But in the notification, the system is changed to 3 professional years. So 1.5 years is considered as first professional BMS. Next 1.5 years is considered as second professional BMS, and the third professional BMS includes 1.5 years. This was earlier present up to 2011 batch. So up to 2011 batch, this was the same. Like 10 years ago, this system was already existing. But from 2012 onwards, there were major changes, just like how the notification has come now. During those times, the notification included 4 professional years. That's why the system was changed. But analyzing the growth or progress of this kind of education in the last 10 years, the NCISM has again decided to go back to the previous methodology, that is professional year courses in relation to 1.5. So totally the student will be giving 3 university examinations. Ultimately the student, as time to understand each and every topic in those 1.5 years rather than 1 year as of now. So that is why you have 4.5 years with only 3 professional BMS and then compulsory rotatory internship. There is no change in that. 1 year or 365 days to be precise should be completed before avoiding him with the BMS degree. So this is one of the major change. Now the tentative schedule of a BMS course is usually starting from October. So usually starting from October, usually first +1, +2 gets over by March or April. If there is no any other obstacle, like we are facing the COVID situation now, usually it finishes by March. So after that the student will be having 1 or 2 months time, then he will be giving the NEET examination. So by May or July, June, he will be finishing the exam, and then the results are out, and there are certain procedures, formalities of creating the counseling structure. Then the seats are allotted, the students will join. So ultimately by October 1st, the student will be in the college attending his first class. This is the tentative schedule. So if you start by October, for example, take this year, October like 2021, if you take October 2021, then 1.5 year course comes to up to March 2023. So March 2023, the first professional BMS should be completed. This includes even the exam. Exam should be completed by March. Now April 2023 onwards, the student will be entering into second professional BMS, and it goes up to 1.5 years. So September 2024, the exams of second year should be finished, second professional BMS. Now October 2024, the third professional starts, and then it should be finished by March 2025. So it is just an example. So what it means is, within those 4.5 years, the final year exams are also completed with the results being out. Now seeing that case, April 1st of 2025, the student will be entering his first day of rotatory internship if he has cleared all the subjects. Now, and it will go up to March 31st of 2026 if there is no delay. If there is delay in completing rotatory internship, it may further go as per the days. But if he is regular, then by March 2026, the student will be finishing. So this is in brief. If a student regularly completes his course and internship in time, then October will be the beginning, and he will be finishing the internship by the March. That is 5.5 years exactly after that. So this is the tentative schedule for a BMS student. Now the pattern of study is divided into 2 parts. One is the main program, that is the major part of student's life in BMS, and another one is electives. Now what are these? We'll just see in brief. Main program is in relation to the classroom study. So the classroom and the study what is given even now, even the present situation is the same main program. Now each of the professional BMS will be having separate subjects. So the first professional BMS, the student will be taught the basics of Ayurveda with base of anatomy and physiology. So there the student will be having 5 subjects. One is Samhita-Siddhanta, that is in relation to most probably Ashtangaradhyam. Then there is a subject called as Padartha Vijnanam, which helps the student to understand the basics of terminology in relation to Ayurveda and concepts of Ayurveda. Now another subject is there called as Samskritam. So this is a basic need of any BMS scholar. So he requires the knowledge of Samskritam and Ayurveda Ityasa, certain history of Ayurveda, which is never taught in the prior to BMS. That is why there are certain syllabus in relation to Ayurveda history. Earlier this history part was merged with Padartha Vijnana paper 2, but now with this change, the Ayurveda Ityasa is given along with Samskruta along with Ayurveda Ityasa. This is one of the major change, and Padartha Vijnana is kept as it is. It is an independent subject, unlike the previous methodology where Padartha included Ayurveda Ityasa in the second paper. This is one of the major change. Other things are same. Anatomy and physiology will be taught under the subjects of Kriya and Rachana. And ultimately there is one addition here. You can see elective subjects. Each of the professional year BMS, the student has to attend at least 3 electives, not attend complete 3 electives. Now what are these electives? We'll see later. Now in relation to second year, second professional BMS, the student will be taught regarding the examination of the patient in the subject of Roganidan. He will be taught regarding the herbs and certain other drugs lie in the subject of Dravyaguna. how to prepare the medicines and what are the rules in preparation of medicine in the subject of Rasishastra and Vaisheshya Kalpana. And in relation to forensic medicine and the toxicology will be taught in the subject of the Agatha Tantra. Will be even taught regarding the preventive Ayurveda concepts in Swasthavavrata and Yoga. Along with that, there will be a Samhita in relation to probably Charaka Samhita. The first part, or you can say the first half of Charaka Samhita will be taught in second year. So as earlier, here also the electives are minimum 3. 3 minimum electives should be completed by the student in this 1.5 years course. So what are these electives? Again, we'll see that in later. So in the third professional BMS, once the student is aware of the examination pattern and the medications, he will be given a thorough clinical touch in subjects like the general medicines, the surgical procedures and the ENT related procedures in the pediatric OPD as well as the obstetrics and gynecology related subjects. All will be taught in the third year. And specific Panchakarma procedures are also dealt in detail in the third professional BMS. As earlier, the student will be taught again the electives. Like electives 3 are minimum. To help the student further in his professional life, the subjects of emergency medicine, which are very much necessary for each and every doctor, irrespective of the science what he is studying, and also the research methodology and medical statistics. The basics will be taught in the final professional BMS. So this is in relation to how the subjects are divided in the BMS course. As soon as the student enters the BMS course, the first year will not be started immediately, the subjects as such. The initial 15 days will be called as the induction program, or you can say the bridge course. Why? Because +1, +2 and BMS syllabus are not directly connected, because we are studying the Western system of education since till +1, +2. Then suddenly you are entering into the traditional Indian system of medicine. So there is a huge gap between the two. To bridge that, to give an idea to the student regarding his future 5.5 years of study, an induction program will be conducted and should be conducted by each and every institute. Minimum of 15 days and each day 6 hours should be given. So in that way, minimum 90 hours of induction program will be given. During this time, the student will be given basic idea regarding Sanskrit, the basic life support, the first aid and other basic emergencies should be known by a doctor. So this is in relation to induction program. Then the first year subjects will be taught. So these subjects will be taught by the staff or the faculty belonging to 14 departments of Ayurveda. 14 major departments. There are other even sub branches or minor departments, but 14 major departments, among which the Samhita-Siddhanta and Sanskrit takes the central place, because the student will require this department from the first professional BMS up to the final professional BMS, and especially the 60% of the portion of first year will be dealt by the department of Samhita-Siddhanta and Sanskrit. And then Kaya Chikitsa department will also have major responsibility in molding the student in final year. As you can see the subjects here, Swasthavavrata and Yoga, in addition to their own subject, will be also dealing with medical research and the research methodology and medical statistics. Of course, each and every college will have certain visiting professors in relation to statistics, and research may be distributed by the staff belonging to the expertise of that field, and the handling of those subjects will be dealt by Swasthavavrata. It need not be like the teachers of Swasthavavrata will be taking that subject. They will be handling the subject regarding who will be taking which topic. Then the other departments will be taking their respective subjects. No additional subjects for the other departments, as you can see here. Next, in relation to electives, I was talking about electives, 3 minimum electives in each professional years. So what is this electives? Electives means basically these are not a compulsory kind of subjects. Like I don't give you 3 subjects and study this. Here the student has the freedom of choosing any 3 electives as per his choice. There will be a list of electives for each professional BMS. The student can choose what he likes based on his futuristic thinking. What is his future approach? So basically it's an online program. Allied subjects may be covered, and it is one step towards the interdisciplinary approach. The student should be having interdisciplinary approach when he is out soon after the BMS. For that purpose, these kinds of programs are included, and each of the elective should be will be of 45 hours duration. So it will be divided into 5 modules. 5 modules in the sense each module will be having 9 hours of program. So for me to finish one elective, I should be giving my 45 hours of my online program. So what it means is, initially there will be first module, you can say 9 hours, in which 5 hours will be the lecture by the guest lecturer. That is 1, 2, 3, 4, 5. These 5 hours will be the guest lecturer's time. He will be giving you the knowledge. Then 2 hours will be the guided learning. You will be involving with the lecturer and both of you will be solving certain queries. That is guided learning. Then 1 hour, the expert interaction. There could be even other experts who will be involving in that session. There will be interaction between you and the expert based on your understanding of the subject and queries. And lastly, there will be an hour of assessment, your own assessment. So there you will be assessed and the grades will be forwarded for adding up to the final marks. So this is in relation to one module. So in the same way, there will be another 4 module, and in that way 5 modules will complete one elective. So one elective, I require 5 assessments, 5 expert interaction, 10 guided learnings and 25 hours of teaching. Just multiply 5 to this, you will be getting the ultimate numbers. So in this way, each student should cover 1 elective, 2 electives and 3 electives. So 3 electives minimum, so which means 45 hours into 3. So 135 hours the student should keep aside for electives in one professional BMS. Second professional, again another 3 electives. Third professional, another 3 electives. So why it is planned, I have already mentioned. So these time are way above the BMS timings. So it doesn't mean like within the class hours only this should be finished. These are way above the BMS timings as per the school schedule or the college schedule. The student should give extra time for completing this. Then there may be few queries in relation to the teachers who are practicing with OPDs like Rachana, Kriya, Samhita-Siddhanta, whether they can open the OPDs in institution level, because there is a division among the Ayurveda people like clinical and non-clinical. Certain departments are given clinical tagline and certain are given non-clinical tagline based on the method of their based on the methodology of their you can say work. So a student who is or a teacher who is preparing medicine is given a tagline of non-clinical branch because he is preparing the medicine, not directly involved with the patient. But all these teachers are BMS graduates and ultimately they may have expertise in each and every disease. So what the NCISM suggests is these staff who are belonging to these kind of departments can also take up the patients in institution level. But the rule is they can run a specialty clinic. They cannot run a clinic in an institution level by the headline of general medicine, by a headline of by the OPD of surgery. No, specialty clinic. The specialty clinic in the sense they will be given certain disease specific or expertise specific. Maybe the OPD like skin disease OPD, diabetic OPD, or you can say Rasayana OPD or Vajikarana OPD. So these kind of specialty what that teacher is possessing can be incorporated in a hospital setup as a specialty clinic, and they will be run under the Shalya Shalakyadi, that is the clinical branches. So the name of the OPD, major OPD will be these 8 only: Shalya, Shalakya, Streeroga, Prasuti, Kaumarvritti, GAZATTE, Swasthavritta and Yoga. These will be the Kaya Chikitsa and Panchakarma. This will be the major OPD. Under them you can create a sub clinic, or you can say the specialty clinic. For example, Prameha OPD under Kaya Chikitsa. Now who will sit in Prameha OPD? Anybody can sit based on the expertise. It need not be belonging to these departments. Now who will decide that teacher can sit in this OPD specialty clinic? That will be dependent on expertise. How you decide? It could be the dissertation work what the teacher has carried out during the post graduation, or it could be even Ph.D. if he has finished Ph.D. on which subject has he done his Ph.D. or by training. He might have attended certain 6 months or 1 year of training, and also it could be by the exposure in his BMS days where he has seen multiple patients of same disease, like maybe joint pain related disease. If he is having expertise, he can open a specialty clinic like the pain management OPD under, it could be Kaya Chikitsa or it could be even Shalya. So depending on the need, the institution is free to open up these specialty clinics, and any of the teacher can be deputed there as a consultant. But ultimately, there should not be any OPD by the name of Samhita-Siddhanta. There should not be any OPD by the name of Kriya. There should not be any OPD by the name of Rognidana, Rashastra and such things. So, they can work, but not directly under the name of their department, because we are talking about institution level. We are talking about OPD and IPD. So, the terminology, what the patient understands, that should be the major consideration, not the minor consideration of the subject. So, that is the ultimate goal what the NCISM has set. Now, in relation to examination setup, at the end of each professional year, there will be the final examination conducted by the university, and there are certain rules for promotion. For example, the student who has cleared all the subjects will be promoted obviously, but if he has failed in one or two subjects, will he be allowed to enter the second professional BMS with his friends? Yes, provided he completes his other papers in the due course of time. If there is an exam on March of 2023, if I fail in that, then there will be a supplementary exam in 6 months of time, in the September. So, in the September time, I can take 1 or 2 papers, I will finish that. Even if I fail there, again I can take up another exam which is going to be conducted in March, supplementary, and I have to finish that. Then, along with my batchmates, I can enter into the regular second year examination, second professional examination. But otherwise, if I have failed in more than 2 subjects, like 3, 4, 5, then what happens? I will not be allowed to sit with my batchmates in the second professional BMS examination. Even though I can clear those in the supplementary exam, I will not be allowed to sit with the regular batchmates. I will be able to only write 6 months later to my batchmates. So that is why a student who has failed in more than 2 subjects, more than 2 in the sense 3 or more, he will be called an odd batch student. Odd batch student, what it means is, he will not be allowed to sit along with the batchmates. And in detail in relation to this terminology called as odd batch, these rules I will be taking up in the coming videos in relation to examination in detail, and that time we will be discussing them in detail. And an odd batch student will not be given separate class. He will have to attend the class along with his batchmates, or if he is getting late and the batch has already gone out, he has to sit with the juniors. That is the rule. He will not be given separate training. Internship. To enter into internship, the student has to complete the BMS, 3 BMS examinations, promotions, and all those things should be completed. 9 electives should be completed, then only he will be entering the internship. Imagine a student who doesn't enter the college for 3 to 4 years, maybe for any reason. Will he be able to enter internship after 5-6 years? So the answer here is, irrespective of date of joining, the student should enter the internship before 10 years. Maximum of 10 years is given. For example, I mentioned here, if I have to enter internship on, if I have joined the institution on 1st of April 2023, so 1st of, you can say October also. So then my internship date should be starting by 1st of October 2030. If not possible, then I will not be allowed to enter the internship. In the sense, my BMS degree cannot be completed. So this is the rule. Within 10 years of date of joining, the student has to enter the internship. Otherwise, he will be deemed to be not eligible to be entering into internship, and ultimately BMS degree will not be credited to him or her. So this is in relation to internship. So the exam pattern has been slightly changed, because earlier there was no MCQ in the undergraduation level. Right now, the examination pattern is changed here as, out of 100 marks, 20 marks, or if you based on the total number of marks, 20% of the questions should be MCQ, multiple choice question based. 40% should be short answers. Short answer may be decided by the university. It can include 2 marks and 5 mark questions, but ultimately 40% should comprise the short answer questions, and remaining 40% questions should be long explanatory type of questions. It could be 10 mark questions or 15 mark questions. That can be decided by the university, but ultimately the percentage of marks should be in this way, and ultimately the entire subjects should be covered. It's not like one particular topic will be given more preference. The entire subject should be covered in these 100% of the marks, so that the student can get the benefit of studying the entire subject. Now, how to consider a student being passed? 50% should be getting in the theory and 50% should be got in or obtained in practical. So now what does practical mean? Practical means it could be the practical direct clinical examination, or it could be certain practical like pathological labs, or it could be the viva, direct question answer session, and internal assessment. The entire year the student will be assessed internally. It's not like the only university exams are considered. The entire year is divided for internal assessment. I'll be discussing that in the coming videos of exams. And electives, what are the grades and what are the points what he has got in relation to electives, all those things will be added up, and ultimately there will be almost 15 or 30 marks of internal assessment. So the practical part will include all these things, and ultimately the student will be given total marks, the grand total. And here you can see 50% theory and practical in each subject. It is mentioned as each subject. So what it means is, if a student has got, you can say, each subject may have two papers. For example, the Roga Nidana has 2 papers, 1 and 2. Now if you get 45% in first paper and if you get 60% in second paper, combinedly you are going to pass Roga Nidana. So what it means is, in each subject, specifically each paper is not mentioned. So even if one paper goes not in your way, you can make up in the next paper. Ultimately that subject, when it is combined, the person should be getting the 50% of the mark. Next, what is the selectives and how to assess that, I am going to discuss in detail in the coming video. Now, how to give the result of a BMS exam. So that is like, if a student has more than 75%, distinction is declared. 65 to 75, the first grade or first class is declared. But if a student gets this amount of marks in supplementary exam, then he will not be given these kinds of grades. So during the course of study, if a student wants to transfer to another college or another university, then after first professional BMS, he or she is allowed to do with consent of both college, mutual colleges and mutual universities, provided the seat is vacant in the other college. So there should be a vacant seat, not the additional seat. If a college is given 100 seats, 100 are full, they cannot take more than 100 seats. If it is vacant, if there is mutual agreement based on their rules of university and the college, by paying certain amount, student is free to migrate to another college. During the internship, also the student is allowed to enter into other hospitals, other institution hospital, again based on the mutual understanding, mutual consent. But the thing is, no midterm transfers are allowed. Allowed. So internship tentatively starts from April and ending by March, as I already mentioned. In the coming videos, I will be discussing in relation to the examination pattern and certain rules in the internship. A separate video for the teachers or the faculty of Ayurveda, what are the implications or changes that are being made in this notification. So all those things will be discussed in the coming videos. So I hope you like this video. If you like the content, kindly like, share and subscribe to our channel. Kindly tell your other Ayurveda loving friends to know about our channel and go through the content. So until next time, myself Dr. NANDEESH, thank you.